Thank you all so much for coming. So today we have a presentation entitled Credit for Caring, and we have two wonderful speakers that I'm going to introduce in just a moment. But we wanted to take a minute just to talk about Lexington Goes Purple as the sponsoring organization of the presentation. So Lexington Goes Purple is in our 9th year. It's gone by pretty quickly, 9 years. And we are part of the Alzheimer's Association's Longest Day program, where communities are encouraged to come together and do activities of their own choosing to raise awareness and funding for Alzheimer's and other dementias as well. So I guess this is us walking in the Patriots Day Parade, which we do annually.
It was a big one this year.
And it was, yes, it was very important this year being the 250th anniversary. So there are all sorts of ways that you can support us. You can display a lawn sign. It's super easy to do. You can just go to that URL at the bottom over there and provide your address. We will drop off the sign. You will also pick it up. So it's a really low lift, but it's one way of showing your support for Lexington Goes Purple and finding a cure for Alzheimer's. We host a series of events, and this is our second event in the series. We had one last week, we're having one this evening, and then we have one next week. And the program next week is on responding to dementia-related behaviors and what support can be provided. We do have a flyer in the back if you're interested in finding out more information or taking that with you. Another really fun event, which is this Saturday, if anybody has a dog or access to a dog to borrow, we encourage you to come out and join our Purple Puppy Promenade. It's in Hastings Park. It is really a very wonderful sight to behold. So if the weather is good, or even if it's raining, come on out and take a walk with your dog. Or if you don't have a dog, just drop by to see what's going on. It's a lot of fun. We also this year are working with Knit, Tuck, and Purl, which is a local shop in Lexington. It's a yarn shop, a knitting community. And we are working with them as they are selling kits where any knitter can knit a square, and then they're going to help us assemble that as a blanket that we can then display in various locations. So if you are a knitter or know a knitter or want to become a knitter, because they also offer knitting classes, that's a very easy thing to do. The kits that they are selling are $35, and a portion of those goes towards Lexington Goes Purple and the Alzheimer's Association. And so this is just the summary of all the ways that you can help us. We've done this for 9 years, as I said, so next year will be our 10-year anniversary, so we'll come back bigger and better than ever, and the events start kind of middle of May. We typically begin communicating about them around Patriots, maybe a little bit before Patriots Day. But we have a sign-up sheet in the back, so if you want to stay informed to our activities and what we do for the remainder of this year and next year, feel free to put your name down and your email address as well. So, I'm going to introduce our wonderful speakers. So we have Lainey Titus Samant. Am I pronouncing all that correctly? Great. She is the Senior Advocacy Manager for the Alzheimer's Association of Massachusetts and New Hampshire. Lainey recruits and engages volunteers, so all of you can volunteer, to advocate in support of the association's public policy initiatives with their state and federal legislators. She also works directly on the Massachusetts public policy agenda. Lainey has been a public policy and advocacy professional for over 20 years. She's worked with the Massachusetts State House, as well as for nonprofit organizations advocating in Massachusetts and on the federal level. She received her master's in public policy from the McCormick School at the University of Massachusetts in Boston, and she lives on the North Shore with her husband and 2 daughters. So thank you, Lainey, for being here. We really appreciate it. And then Liz is also here as well. Liz McCarthy, who's right over here. Liz is the Health Systems Director for the Alzheimer's Association New England region. Her work is focused on engaging health systems to drive direction, diagnosis, and person-centered management of Alzheimer's disease and other dementias. She has a personal lived experience with dementia through caring for her mother. And Liz lives outside of Boston with her husband, Kevin, and a crazy dog named Juno. So she is welcome back on Saturday to bring Juno along for our puppy promenade. So thank you both for being here. Really appreciate it. So hand it over to Lainey.
Hi everyone, thanks so much for coming out tonight. So they've asked me to speak a little bit about policies that impact caregivers. So as Anessa said, I work in our public policy and advocacy program, and so we really work to push legislation at the state and federal level that impacts people living with Alzheimer's and dementia and their caregivers. So tonight I'll be focusing more on those bills we work on that impact caregivers. So I just wanted to back up as well just to talk about why we advocate. Jean here could tell you why, because she's a wonderful advocate who's been doing it with us for many years. But really, Alzheimer's disease is one of the most critical public health issues. The amount of people with Alzheimer's disease is growing and fast, and obviously, as many of you may know, the cost is far more than financial. But also financially, it is a major, it is one of the most expensive, I think maybe the most expensive disease in the country. So something that it obviously impacts our governments as well. So we advocate to change the trajectory of the disease and to reach everyone who's impacted by Alzheimer's. And also, obviously, the burden is large. Here in Massachusetts, there's more than 135,000 people aged 65 and older with Alzheimer's. That's about 11%, a little over 11% of adults over 65. And there's 213,000 people acting as caregivers to those living with Alzheimer's. So this is always an interesting statistic. That amounts to 246 million hours of unpaid care. And so, again, something that I think a lot of people are already aware of, but family caregivers are the backbone of services and supports in this country. So 83% of older adults in the United States rely on unpaid care from family, friends, or other caregivers that are close to them. So of those, nearly half are caring for someone with Alzheimer's or dementia. And then, while nearly 7 million Americans total are living with Alzheimer's, there are over 11.5 million dedicated family members and friends serving as caregivers across the country. So again, obviously, this is a large impact on our country, a large impact on many people living in the country. So therefore, we want to change public policies to support all those people. So again, to talk a little bit more, in 2023, Alzheimer's caregivers provide an estimated 18.4 billion hours of unpaid care. So it's an average of nearly 31 hours of care a week. We always like the statistic. Those hours are valued at nearly $300 billion, which is 15 times more than the revenue of McDonald's in 2022. So that kind of puts it into perspective of how much money that really is. So like I said, we advocate both on the state level and the federal level. So I'll talk first about some of the work we're doing on the federal level around caregiving. Again, family caregivers need support as they take on the costs and responsibilities associated with caregiving. So in addition to the personal input you put into caregiving, there's also the financial cost of it. We have advocates who talk about having to get a specialized wheelchair for their loved one because they were very tall and they needed a special wheelchair, or having to step back from their own work to care for a loved one. So obviously, in addition to all of the other emotional impact it has, there is a financial toll on people caring for others. And dementia caregivers spend more than non-dementia caregivers on out-of-pocket costs. There are approximately 25% of Alzheimer's caregivers who are part of the sandwich generation, so caring for a child or children and an older adult who has Alzheimer's. So obviously that impact is even further when you're caregiving on both ends of the spectrum. The total lifetime cost of caring for someone with dementia, 70% of that is borne by families. So again, obviously a major financial impact. And many families cut back on saving contributions and spending on other household necessities. We definitely hear about caregivers who don't take care of their own medical needs, including their prescription costs, because they're caring for their loved one, and there are other costs associated with that. So definitely something, it impacts so many people across our state and country, and something that we need to make sure that we're helping as much as we can. So there is a bill in Congress that we've been involved with since the beginning of this year when the new Congress started. It's called the Credit for Caring Act. And this is something to hopefully have at least a small impact. It's not going to solve everything for caregivers, but something that should help a little bit to ease some of the burden and the financial strain. So it would create a new non-refundable federal tax credit of up to $5,000 a year for eligible family caregivers to try to address some of that financial impact. And so caregivers for loved ones of all ages could receive the credit. And just to be clear, it's not specific just to Alzheimer's, it is for any caregivers. We are working with AARP on this bill. So it's kind of broad coverage. It's not only for people living with Alzheimer's. And so as long as the care recipient meets certain functional or cognitive limitations and the caregiver meets certain income requirements. I know there's also a part of the bill that's not required that you live with the person you're caring for, which can be helpful since some people still live apart, but they're still doing a lot of caregiving and have those financial costs associated with it. So working family caregivers qualify regardless of whether they live with their loved one or not, or if their loved one is a dependent, so they don't have to be considered a dependent to get this caregiver credit. Again, it will help reduce the need for caregivers to sacrifice some of those basic needs, to stop putting away savings, and improving their overall well-being and stress levels of that financial strain. And so I'll go into our Massachusetts work now. So we're really excited this year. We introduced new legislation in Massachusetts, and it's called we're calling it the Alzheimer's Act of 2025. Its official title is an act to improve care and prepare for a new era of Alzheimer's and dementia. So Alzheimer's Act of 2025 is a little catchier and quicker to say. So two of our champions in the House and Senate are sponsoring this bill, Rep. Danielle Gregoire, who's from Marlborough, and Senator Adam Gomez, who's from the Springfield area. So in 2018, a major sort of groundbreaking at the time law was passed in Massachusetts to address some of the concerns around Alzheimer's. So it looked at certain things like making sure hospitals had operation plans to address people living with dementia and make sure they're planning certain things around that. It required physician training and nurses and physician's assistants to be trained. So a number of different changes were made through that 2018 law. And it was sort of at the time a bunch of different bills that were combined to create this law. So looking at the success of that, and because it has been 7 years since then, we wanted to look again at bringing a more comprehensive bill. So not something that just was one small change, but a larger change. So, and this is something that's somewhat unique to Massachusetts, what I'm learning from some of my colleagues across the country. Massachusetts tends to like to do bigger packages of things, like let's just tackle it all at once and get it done. It wouldn't work in New Hampshire, our other state within the chapter, but it's something that has worked in Massachusetts, so we're just going with that idea that they tend to like to address a bunch of different things related to an issue at one time. And it also allows us to look at what has, what are the gaps since that 2018 law passed. So what needs to change since then that wasn't maybe addressed at the time, or even is more of an issue now because of the fact that there are treatments now when in 2018 there weren't treatments. So I'll quickly touch on the different points of this bill, but then I'm just going to focus in on the pieces that really are related to caregiving. So again, it is a pretty large bill. So there is a portion of the bill that talks about public awareness and public health infrastructure. So it would require that the Department of Public Health includes information on Alzheimer's and brain health as part of their regular public health campaigns. So the Department of Health might do, the anti-smoking campaigns or the the diabetes campaigns, heart health. We want to make sure that whatever they're doing is part of their regular operations. Brain health and Alzheimer's are included in that. It also requires different public awareness campaigns directed towards healthcare providers as well, in addition to just the public. It requires dementia training for first responders. This is something we're really excited about, and we've talked to many of the first responder groups in Massachusetts, the professional firefighters, the police officers, and they're really supportive of this because we feel like it will help both the families who have to rely on the first responders as well as the first responders themselves, just to have more knowledge, ways of communicating with people living with dementia, signs of someone living with dementia, and also they're in a unique position where they often are called into a home during a crisis, so they can see sometimes if there's signs of neglect or abuse. So thinking if we could provide that training, it would be beneficial for everyone. So hoping we can do that. And that would require training both when they become a police officer, firefighter, EMT, and then also ongoing training. Dementia care coordination I'll talk about in a few minutes since that relates to caregiving. It does allow for a few different specialties of people that treat people with Alzheimer's, can diagnose Alzheimer's. It adds them into the Massachusetts Loan Repayment Program. So that's something that physicians can apply for, actually nurses as well, to get money back on their student loans. If they're practicing in certain areas and as a certain type of provider. So it adds in some of those providers as well. And then patient and family notification, our 2018 law required that, and this is always a little hard to imagine, but before the 2018 law, you weren't required as a doctor to tell your patient if they had Alzheimer's or tell their family support. So the law required that physicians are required to tell patients that they have Alzheimer's and their family caregivers, if appropriate, and also provide information to them. So the gap we saw in that was it only said Alzheimer's. So it didn't count if someone had Lewy body dementia or something like that. So this would just add in dementia, so that's kind of equitable there. The hospital operations plans, as I mentioned, the 2018 law required hospitals to create an operations plan. But again, when you pass legislation, you sometimes see how it works in the real world. And we didn't have, they had a requirement to do it, but then no requirement for anyone to look at it and approve it, and also no requirement to update it, which we think is really important, especially now with treatment coming out and things evolving. We want to make sure that this is something that stays fresh and stays present. So it's now going to be required to be submitted to DPH and approved, and then shared with a number of people, and also required to redo the plan every 5 years. And then, yeah.
I have a question on the workforce.
Mm-hmm.
There are a lot of immigrants working in nursing homes and in memory care units now, and some of them are going to be affected by what's happening in the country
mm-hmm.
right now. Is this law going to address some of that?
This law wouldn't, no. No, I think that might be something more on the federal level, but it's something definitely the association is aware of. We met recently with Congressman McGovern in his office in Worcester, and he brought up that concern. Definitely a number of things related to the Alzheimer's community that there are concerns about. Things like immigrants that care for people in their homes or in nursing homes no longer being able to be there, or Medicaid funding. So much of nursing home care for people with Alzheimer's is paid for through Medicaid. So definitely concerns about that, but the association is kind of keeping an eye on everything and just seeing where things go with that, and obviously supporting whatever we can to make sure our community is protected. And then again, the caregiver and patient rights, which I will speak about more in a moment. So the dementia care coordination piece, so the Mass New Hampshire chapter has a really fantastic program called Dementia Care Coordination. What happens is a physician can recommend that someone gets called by a care consultant, and they call them and they help them kind of make a plan with their caregiver on different services that are available, things like that, planning for the future. We've heard from many people that it really reduces stress and is so helpful to have that care consultation. And also, you know, there's been studies that show it reduces hospitalizations when you've had sort of programs sort of like this, helping the caregiver and the person living with the disease. So there's 2 programs in Massachusetts that are healthcare programs that are Medicare, Medicaid, dual eligible. So this is really some of the most vulnerable people in our state. They're both lower income and over the age of 65. So what this bill would do is require that dementia care coordination is provided as a benefit to anyone in one of these programs. So that would hopefully, you know, again, help reduce the stress on caregivers, but also would just, you know, help to make sure their journey goes a lot smoother, that they have the supports they need and can reduce, you know, hospitalizations, that sort of thing. And it also, again, in addition to the benefits for the caregiver and the patient, it reduces the cost and burden on our healthcare system if they're needing to use some of those more crisis emergency situations less. So that is that one. And then the caregiver and patient rights section of the bill is really looking at how to make the stay in the hospital a better experience for the person living with dementia, but also for the healthcare providers as well. We actually had our advocacy day at the State House in February, and that's when advocates from around the state will come and join us, and they go to speak to their legislators. And we had a physician from Mass General who was speaking. And she talked about how she had this patient who really was going downhill very quickly. Her breathing was, you know, her oxygen levels were low, her heart rate was high. And what they did is they actually got her granddaughter on the phone. And when she started speaking to her, they quickly saw her blood pressure went down, her breathing started to regulate, her heart rate started to regulate. So just showing that you know, having a caregiver there with someone can be so helpful to make sure that what they're actually there for at the hospital can happen. They can actually get that treatment and that they're calm and able to be comfortable. We've also had some advocates reach out to us as well who I think in the past few years were not allowed to stay with their loved one at the hospital. They were required to adhere to visiting hours. And so the person was, you know, alone all night and not able to advocate for themselves. And you know, he had some falls, various things like that. That's one person I'm thinking of, but we have heard from a number of people about those concerns. So this bill would allow someone to stay with a patient with cognitive impairment at all times, regardless of visiting hours. And again, feeling as though this is really a benefit for both the patients and the healthcare professionals. And, you know, of course, as, you know, if there's an emergency situation and they can't be in the room because it's not healthy for the patient, you know, there's exceptions for that, but for the most part, allowing people to stay with their loved one. And just because they understand their needs, you know, and they can really advocate for them. And then, so this piece of the bill is again under the caregiver and patient rights section. So this is requiring that the hospital notify a caregiver when someone is admitted to the hospital. So making sure they're aware that their loved one is there and getting treatment so that they can kind of be there and be a support to them. And also importantly that someone is notified before anyone with cognitive impairment is discharged. Unfortunately, there was a situation in Massachusetts last summer where a man was in the ER, his family didn't know he was there, and then he was discharged and unfortunately later found had passed away. So really trying to avoid, you know, situations like that to make sure that people are told when their loved one is in the hospital. It also has a requirement that if there's not a caregiver to contact upon discharge, that they're required to meet with a social worker to make sure they have the supports they need at home. So the other thing, so that's that bill, the Alzheimer's Act of 2025. And so the Massachusetts budget is also another place where we can enact some different policies and make some positive change. So for the past 3 years, the Massachusetts state budget has funded, provided $300,000 in funding for the dementia care coordination program that I was speaking of. So This year, their budget process started in April. The House Ways and Means budget didn't include funding for this, but they haven't traditionally. They've usually included it in the Senate budget, so that's exactly what happened this year. One of our champions, Senator Pat Jalen, filed an amendment to include the full funding, and the Senate did adopt that amendment. So now the budget bill will go to a committee of members from the House and Senate to iron out those differences. But for the past few years, that's kind of the process of how it's gone, and it has ended up in the final budget. So we're optimistic that hopefully it will this year. It really allows us to expand that program, serve over 1,000 families. I know in the past couple of years, thanks to some of that funding, we're able to add some care consultants who speak different languages to provide care to or services to different members of communities. So hoping that will go through this year, but we're optimistic that it will. And one other caregiver legislation I'll mention in Massachusetts. This is not one of our bills. The others are things that we drive. This is just something we're supportive of and have indicated our support to AARP, who is leading on this. So similar to our thought process, we were doing this on parallel paths and talked and realized we had the same idea. They're taking a number of different caregiver bills that were introduced in past sessions and combining them into one larger act supporting family caregivers. Similar to the federal level, this would include a Massachusetts income tax credit to cover expenses, respite care vouchers, unemployment insurance eligibility, addresses workplace discrimination, and establishes a permanent commission to focus on caregiving needs. So that's really important too, because I think as things evolve, the commission can kind of keep looking at what else is needed in the state, and many of those commissions make recommendations for new legislation. And that is what I have. I'm happy to answer questions, or if we want to move to Liz, either way. Yes.
Go ahead. That's a question I have one too.
Oh, you go first.
Okay. So I noticed, I'm sure I'm wrong, but I noticed in your presentation that the only thing that really caught my eye as a caregiver that would be not just funding administration costs was the voucher for respite care. And I'm wondering, A, if that was true, if there was like a program that actually provided. I've interacted with a lot of people around Alzheimer's, and I have not really felt helped.
Yeah.
In any real way. So that's what I'm sort of, if you can point that out to me, I would be, I'm not being sarcastic.
Yeah, no.
No,
I completely understand.
I'm sort of dismayed with the idea of commissions and coordination and having worked for the state government for a number of years. I have maybe a somewhat jaundiced view of how those things tend to operate and where that money goes.
Yep.
And I'm a little concerned about presentation that says this is how we're going to help you as caregivers, because I'm not seeing that.
Yeah. We're hoping the hospital one will, it's not something that helps you in your regular life as a caregiver, but would hopefully help in crisis situations.
I see that turning into someone from the hospital saying, you have to stay here. We can't handle him or her.
Interesting. Yeah, I mean, it definitely is written that they have the right to stay, so it's not like required that they stay, but just that sort of they have that right. And the tax giver, the tax giver credit should hopefully get rid of some of the financial burden. But I know what you're saying about the actual help to you, and I know the Dementia Care Coordination Program is something that really does help caregivers. It's a consultation one-on-one. The funding for that will certainly, go to specifically to helping families kind of, determine what services are there for them. But Liz, I know you wanted to add something in here.
I wonder if that might be a good transition to the guide program.
Yeah.
Exactly.
I think that actually answers your question. So if you want to,
do you want to answer? I'm going to talk about the guide model, which is a Medicare payment program. So I
And that
hope
has
that will
direct,
address, yeah.
and that has direct caregiver support. So we'll, definitely cover that.
So I think the state has to step up one way or the other. I don't know if this legislation is the way to do it, but there's an issue there.
Yeah.
Just quickly, were you at our
What?
Were you at our presentation last week?
Yeah.
Last Wednesday?
Yeah?
Okay, so we talked a lot about ongoing research there.
Yeah,
But
I
your
know.
question is well put in terms of
Yeah.
ongoing funding.
Yeah, and what I didn't mention is, we definitely have other things we're working on, but I focus more specifically on caregiver things here. But we do on the federal level have, we advocate for increased research funding. We're actually going to DC this weekend through the beginning of next week to meet with members of Congress. We have about 1,000 advocates from across the country. So every single member of Congress is getting advocates coming and meeting with them. And they've just told us today the first thing we're talking about is just making sure with the current climate that we don't lose ground. We're making so much progress, we need to make sure we don't backtrack. So, so that's something we'll be addressing with all members of Congress, and then again looking for that additional research funding because it's so important, and making sure that continues. And so there's definitely on the federal level a number of things we're doing around research.
It's good. We need a moonshot, just like with
Yes. Yeah.
100%.
Yes. You mentioned these things were added into a bill that began in 2018. Can you summarize briefly what the initial bill was all about, or are there any key points?
Yeah, so the 2018 bill actually passed into law at that point. So this bill isn't, it's just based on that, the success of that and kind of the process that it took. But that bill is already in law. So so a number of things. For one, the Alzheimer's Advisory Council was formed, and the state now has an advisory council that meets quarterly to discuss caregiver issues and a variety of other things to determine what changes can be made at the state level. The hospital operations plan was in there. The training for required training in order to get your license renewed for physicians and nurses, nurse practitioners, physician assistants, and also protective service workers. And let me think, this was before my time, but I read it many times. I think that might be all of it. Yeah.
Thank you.
No problem. Any other questions before Liz takes over?
We can do another round of questions at the end.
Yeah,
for
sure.
sure. I'm Liz, and I know I was introduced at the beginning, but Lainey gave such a great presentation that I wanted to remind you who I was. So I'm Liz, and I've been with the association for about 9 years, and I cover all 6 New England states. So I get to work with advocates at 6 different state capitals, and it's always a lot of fun. And I tease my colleagues in advocacy because I say they come up with these gigantic bills and they get approved because they have their advocates and they have their champions in the House and the Senate, and then they say, okay, Liz, figure out how to do it. So so I've done a lot of work with the operations plans and then with the education pieces, and happy to answer questions about that. But I'm sorry, what was your name?
Barbara.
Barbara, hi, I'm Liz. Barbara's question is a great one, and it's so important. And what are we doing for our caregivers, like specifically? And how are we going to keep you from pulling your hair out, or keeping you healthy, or giving you the supports that you need, or even just recognizing what you're doing and what you're giving up to keep your loved one at home? And it's a great question, and we respect it greatly. And so all the advocacy that we've done over the years in Washington, it culminated in a prospective payment plan from Medicare. It is right now an 8-year pilot with 400 sites throughout the country, and it's being piloted. GUIDE stands for Guiding an Improved Dementia Experience. And the entire thing revolves around what we call dementia care navigation. And the dyad, the patient and caregiver, or it could be more than one caregiver, right, is at the center, right? And then all those supports are around what are we going to do to make this team succeed? So what they recognize, they being the payer, CMS, the payer, is that the unpaid care that caregivers offer to their loved ones that's not being recognized. Also, that there needs to be a built-in place for respite. You cannot be someone's person for 24/7, 365. They also recognize other chronic conditions and chronic diseases. Think of cancer. You get a navigator, right? And that navigator helps you make appointments, do follow-ups with specialists. If you've got a person living with dementia, you've got a primary care doc, you might have a geriatrician, you might have a geriatric psychiatrist, you might have a neuropsychologist, you might have a neurologist, you might have, and then if you have other chronic conditions, you might have a cardiologist, you might have an endocrinologist, right? So who is helping to sort this out and explain to people? And that's your navigator, right? So this model really relies on the navigator. Now the navigator is kind of the nuts and bolts person making these things get done. They work in along with typically a nurse practitioner and often a geriatric specialized nurse practitioner. And then with the physician who's kind of guiding the care and really focusing a lot of the care focuses around medication reconciliation. What is every drug that those 10 doctors that I just named, what is every doctor prescribing, and what are those drugs, how are they interacting, and how are they impacting the person's cognition and mental state, right? So it's really looking to address all of those things. The program has 11 key elements to it. Respite is one of them. Care navigation is another one of them. The care navigator needs to go through 20 hours of training, 10 hours of didactic, like learning, and then 10 hours hands-on, working with the nurse practitioner and physician. They also work a lot hand in hand with organizations like the Alzheimer's Association, like local senior centers, and like area agencies on aging, even AARP, anything that's going to get the person the resources that they need, right? And it's always, as we always say at the Alzheimer's Association, if you've met one person with Alzheimer's disease, you met one person with Alzheimer's disease, because all of those other variables affect the condition. So the guide model right now, as I mentioned, there are over 400 across the country. And then Inessa was kind enough to pull together the guide providers here in Massachusetts. I want to make a couple of notes that Empower Me Wellness, Neuroglee, Tembo, and you have those two highlighted.
Yeah, I missed
and
the third one.
That's okay. They are online virtual programs, so that the person doesn't work. If I'm Dr. Liz and I have a geriatrics practice and it's a very small practice and I don't have a nurse practitioner and I certainly don't have anybody who can be a care navigator, I might want to partner with Tembo, Empower Me, or Neuroglee, and they have a nurse practitioner, so I'm good, but they might be located in, California, Iowa, Chicago, somewhere else, right? So I'm the local contact, but they're going to provide the services that I can't necessarily have in my own practice. It's just a different way of doing the model. It's being able to stratify it and get it out to more people. I talked a lot, so I'm going to stop.
So my understanding of the guide program is like specifically what you get is a 24/7 phone number that you can call as a caregiver anytime to address any kind of emergent need and get some direction. You get the access to this care navigator that's going to help you figure out how to work with all the different doctors that might be in your loved one's universe. You get the medication management and reconciliation, so advice around medication. And I think very specifically to answer your question before, you get $2,500 or up to $2,500 in respite care which I think is really, like, that's finally like that nice tangible benefit, right, that we're all looking for. And just to also tack on, I would say, in addition to doctor offices being able to work with the virtual providers, any one of you, if you're caring for somebody, can also can work with those virtual providers. And they all will work with whatever neurologist, primary care physician, other specialists that your loved one is already going to. So I don't know, I think I might have forgotten to introduce myself. My name's Anessa, and I'm a volunteer with Lexington Goes Purple. I'm a Lexington resident. And I care for my mom who lived with Alzheimer's, who passed away in 2018. So when I heard of the guide model, I got all excited. I was like, I so wish that had been around. Because even though $2,500 doesn't go as far as you want it to, just having access to somebody to ask these basic questions to, that you might not have time to ask your doctor, or the doctor might not have time to answer you.
And just as an add-on to that, it's not just the money.
Yeah.
That your care navigator will find you a respite place. So they will find you a place for respite. They will find a place for your loved one to go and be safe while you go do whatever it is you need to do.
I would say too, so this is a Medicare benefit, and my understanding as well is that you have to be on traditional Medicare, so it's not something that you can access through a Medicare Advantage plan. So it's just one of these practical considerations that are always tripping up caregivers and anybody else who's navigating healthcare.
To that end though, and thanks, I was going to make that caveat, I am working, and I am one of about 16 health systems directors across the country. We're working with health plans. So Blue Cross Blue Shield in Massachusetts, for example, we work with them with our dementia care coordination program that Lainey mentioned. That's a form of dementia care navigation. So we are working with the Medicare Advantage plans to say, what can we do? You need to look at this insurance company because it costs you a lot of money, right? For caring for the person living with dementia. Their hospitalizations are twice as long as people without the disease. They go to the emergency department twice as frequently. So what can we do to make life better for them and also manage your costs? So dementia care navigation, you'll be hearing more and more about it. It's really becoming quite a buzzword. Questions? And thank you so much, Anessa, for
I did have a question,
clarification.
actually. I didn't understand this is Medicare, but not Medicare Advantage.
Correct, it's traditional Medicare.
Right.
You're on a Medicare Advantage plan. Right now, those plans are not covering the guide program. But hopefully they will be through the Alzheimer's Association's continued advocacy, but they're not now.
The reason for that is that CMS, Centers for Medicare and Medicaid Services, is a government agency, and they have an innovation arm called CMMI, Centers for Medicare and Medicaid Innovation. CMMI is running, this is an 8-year pilot, like I said, right? So they need to be able to crunch the numbers, get the data, and they're requiring people to give them a lot of information, each of these practices, to give them a lot of information. Since Medicare Advantage is through a third party, like if you have Tufts Health Plan, Medicare Advantage, or if you have Blue Cross Blue Shield, Medicare Advantage, they wouldn't be able to get that data, right? Because they can't require the third party to do it. So, yeah.
So, say you need to access this guide program, what do you do?
So the first thing would be to talk to your physician and then find out what kind of Medicare you have.
I have traditional.
Perfect. Brilliant.
Mm-hmm.
That should you should talk to your physician.
Through the physician?
Yes.
They know about it?
I don't know if they all know about it. I think there is an awareness problem.
Yeah.
I've encountered that. But you can also go directly. That's why I put together the list. You can also go directly to any of these. I did print it out. I printed it out so small. But if anybody wants to give me their email address, I'm happy to send it to you. It's also on, I should say, it's on the Medicare website, the
Yep.
CMS website. They have some errors in their data, but it's the best we have available.
And around here, Good Shepherd Community Care, they're in Newton and they cover this area.
And they're a wonderful organization.
They really
if you're
are.
not familiar with them.
McLean, great place. We work with McLean frequently, right in Belmont. I'm not saying, like, I'm saying which ones you might consider reaching out to. Like, you don't want to go to Bay State and Springfield,
Right.
although I love them too, but that's a far drive. Care Dimensions, they are a little bit more north, North Shore, but if your loved one or somebody you know is up closer to the Merrimack Valley, that's a great place as well. South Coast, same thing. They're great, but they're on the South Shore. Hebrew Senior Life is also great. It is hard to get to Roslindale, West Roxbury. Like it's a lot of traffic, but definitely they're a great team there, and to call and find out more. So.
I've also met some of the folks over at Tempo Health, and their hearts are in the right place. I didn't have the program available for me as a caregiver, but they seem to have their act together. So if you're comfortable with that virtual provider, that's one that I've met. Yes.
Be aware if you're on an Advantage plan and you exercise and opt in for hospice, the Advantage plan abandons you and throws you into traditional medical care, Medicare, which leaves you responsible for 20% of the hospital bill. Which can be
Correct.
tough.
Yes. Yeah.
It's very difficult to navigate all of this, not only the care, but how to pay for the care, for sure.
Yeah, thank you for pointing that out.
But you can't fight that Advantage plan, which I did.
I heard it covers co-pays, among other things. Is that true?
Say it again.
Does this thing cover co-pay? Somebody told me that.
So for the elements that it covers, so because what it's taking is all of the codes that a doctor would have had a bill under, they put it into one monthly payment that they make to the doctor to take care of all of this. So that eliminates the copay for that piece of it. Now, if you're still seeing other physicians for other conditions, you would still be responsible for those copays.
How does something like, now I'm blanking on their name, Middlesex Senior.
Minuteman Senior Services.
Yes, thank you.
Yeah.
How do they fit into all of this? And I have to say, I didn't mean to say I'd never gotten anything. I know that probably 2 years, we've been at this a long time, ago, I received $400 from, and I didn't really need $400, but from Minuteman through the woman that I've spoken with there. I was so grateful for the recognition that this is hard. It was just, it had nothing to do with money. It had everything to do for me with the, here's something concrete. It really meant a lot to me. Anyway, how does Minuteman?
They would be, the care navigator would, based on your address, say here's an organization you might want to contact. But as far as providing a service, to best of my knowledge, do they have respite?
Yeah, so all the area agencies on aging, and so Minuteman is one. Honestly, I don't know why they have to call themselves all different things. I think that's confusing. But the one for the Lexington area is Minuteman Senior Services. And they do have people on staff that help with some care navigation. And they do sometimes, I think it kind of goes up and down, have access to some funding that they can provide people for respite care. And I think sometimes it's like more formal than other times. So sometimes it's based, like they have the strict income that they have to look at. And other times, they might be able to, like, they have like a check and they can write it out to somebody. So it's very piecemeal, I guess is what I'm trying to say. But they do offer some amount of help, and there is an actual person, on the other end of the line. If they have a referral form on their website, so you can always go online, fill that out, and a real person's going to call you back, and they will again, their hearts are in the right place. They're going to do their best they can to get the help you need, but they're not linked back together with any of these providers. And then in return, some of these providers, if you're looking for local referrals, they might refer you to Minuteman Senior Services and or the senior services here in Lexington.
And Michelle's been paid.
Yes, yeah. So it's piecemeal, and I think it's become better. I think the guide program is amazing, but there's still a lot more. There's still more to go, right? We're not there yet, that's why Lainey's work is so important, to continue to pound the drum and make sure on the state and federal level people are paying attention.
Lainey and her counterpart Chelsea are going to fix this.
Yeah, it's all up to you.
But it is helpful to hear feedback too, because we're always kind of thinking, like every 2 years we have to introduce new legislation. So, what needs to be tweaked, what other changes can be made. The one other thing I did want to mention too is our 24/7 helpline. So if someone calls that, and it doesn't have to be a help situation, a crisis situation, it can just be like, okay, we're dealing with a new diagnosis, or something has changed and I need more support, more services. And someone will always be there to answer the phone 24/7, and many times they'll refer you to someone here in Massachusetts that will do a care consultation with you and can kind of talk through some of these same things. What are your needs right now? They're social workers, so they're wonderful and comforting and understand how challenging this is. So I think that's something I just want to make sure people are aware of as well.
Yeah.
One thing I didn't hear mentioned, if you're in the early stages of that, while the person is still competent, make sure you get a healthcare proxy done.
That's a great point.
Absolutely critical.
Yeah. Certainly that our helpline that Lainey just mentioned, it's something that we always recommend and ask about. It's very critical.
And to build on that, I would say one surprising thing to me, and my mother being caring for my mother, is a power of attorney. Durable power of attorney. In order for banks and other financial institutions to accept that, usually has to be dated within the last year, 2 years, 3 years, depending on the financial institution. Which is something I thought, it's like the one and done thing, and it's not. So that's another part of that paperwork. You just need to keep that updated.
Thank you all so much for your questions and your time.